Hi, I'm Nurse Marcia, a retired nurse with over 30 years experience. So today I want to talk to the next gen nurse, the next generation of nurses. First, I want to say welcome to your career in nursing. If you are preparing to become a registered nurse or a licensed practical nurse, then you are aware of this new style of test questions that starts April 2023. For people who may not be aware, in America, after you finish your degree, you've taken your college courses, you did not buy your test or you did not buy your diploma, after you have legally and ethically gone through your college courses and you receive your degree or your diploma, then you must take the state examination, a national examination. You will get a license to practice as a registered nurse or a licensed practical nurse, depending upon what course of study you took. So this test is given by an organization that we call NCLEX. It's a National Council of License Examination. So what they decided to do was to change things up a little bit. Now, I'm excited about this new type of test because I think we're going to see way more people pass this test the first time. So I went to the website and I got some tips for you. First of all, I say go to the website, NCLEX, NCLEX. I'm going to leave that website in the description below or somewhere up here. And I suggest that everyone who needs to take this test, go to their website and study, because they are the ones who created this new test. And I'm telling you, it's so much good information on that website that is going to help prepare you for this exam. What is this new NCLEX or this next generation NCLEX all about? Well, they decided that they were going to give a test that's going to better measure the nurse's clinical judgment. And what is that? It's going to measure the nurse's ability to demonstrate critical thinking skills and decision-making ability. And this is going to be based on real life scenarios and real life case studies of patients. And on the website, they said over and over to rely on your education, because your education that you got in school will prepare you for this test. So I think that's a hint. Go to NCLEX.com and review all the information about the next gen test on that website. So a few things that I suggest that you do, or I would do if I was preparing to take this test. Again, go to the website, get all the information on their website, and I would rely on my education, what I learned in nursing school, to take this test. Let's talk about clinical judgment. Let's talk about critical thinking skills. So on this test, they're going to be giving you real life case studies or real life scenarios. They're going to give you information about a patient. They're going to give you maybe symptoms, maybe treatment plans, and they're going to ask you a set of questions. In other words, what are you going to do first? What is the most important thing you would do for a person or a patient who has these type of symptoms? Okay, so I'm going to keep it simple. Let's say you have a patient who has a broken ankle. Are you going to give them CPR? No. Let's say you have two patients. You have a patient with a broken ankle and you have a patient that is exhibiting shortness of breath and their color is turning pale or blue. Who are you going to assess first? Who are you going to treat first? the person who cannot breathe, or the person who has a sprained ankle? Which one is more important? Which one will you lose quicker if you don't do something? Now, also, please remember, you don't want to answer those questions according to what you may have seen a real nurse do in real life, because he or she may not have done the correct thing. What you need to rely on is your education. Again, they stress this so much on NCLEX.com. Remember that. Don't answer those test questions according to what you've seen, but according to what you have been taught to do. I think this test is going to be a whole lot easier. NCLEX also says that this test is going to better prepare the new nurse to hit the ground running. It's going to better prepare you for your first job. And maybe this is why they changed the test, because of the need for nursing and the nursing shortage. And according to the statistics that I've read on that same website, we've been having trouble with new nurses passing the test the first time. So I think that there's nothing to be, nervous about. Rely on your education, read the questions, answer the questions according to what you've learned, maybe not what you've seen. If you're working in a clinical environment now and you see all kinds of inappropriate stuff, don't answer the questions according to that. Proceed with what you've been educated to do. Again, they want you to demonstrate your clinical judgment, your critical thinking skills, and your decision-making ability according to what problem a particular patient is having. So another thing NCLEX shared, the test is developed based on the nursing process. The testing was also developed from the nursing theories. And we learned the nursing process and nurse theories in nursing school. This test, which I think is great, you can get partial credits for some of the questions. For example, they would be the questions that is more than one answer. So in that scenario, you're not going to get no credit because you didn't get all 3 answers correct, but you can get partial credit. I think that's wonderful. But all in all, they kept emphasizing how your nurse education has prepared you for this test. So another tip, I would not bother with paying someone to teach me how to prepare for the test. A lot of the nursing students or the new graduates take these NCLEX prep classes. I wouldn't waste my money on that. I would get me an NCLEX book, an NCLEX review book, and I would review the book and I would practice with those questions. That's how I did it when I first became a nurse. I was a licensed practical nurse first. That's how I prepare for my tests. And I am an RN, and that's how I prepare for my RN test. Go to NCLEX.com and review everything on that website about the new test. I think that it will give you the confidence that you will need to prepare for the test. I think that it will alleviate your fears. So I want to say welcome to the men and women who are starting a career in nursing. If you found value today, please subscribe to my channel, hit the like button, leave me a comment, and share Nurse Marsha. Don't keep me to yourself. Bye.